Hello, everyone, and welcome to A Conversation in Veterinary Pathology, the ACVP podcast. Thank you so much for being here today. We are with digital pathology expert Alexander Giroux. Welcome.
Learn about the newest digital pathology trends in science and industry. Meet the most interesting people in the niche and gain insights relevant to your own projects. Here is where pathology meets computer science. You are listening to the Digital Pathology Podcast with your host, Dr. Alexander Giroux.
Thank you so much for having me. I'm excited. I'm honored to be here, and I'm also super happy to be a guest and not a host this time.
Very good. Well, thank you for being here. And I wanted to start off by talking about your platform here and your talks at the 2025 ACVP annual meeting in New Orleans, Louisiana. Can you tell us a little bit about sort of your background and social media presence?
Mm-hmm. Totally. So I am originally from Poland. This is where I went to vet school. And I loved pathology in vet school. I think it was one of the few topics that I was actually good at. But I didn't think it was possible to have a career in pathology. In Poland, you would just have people doing pathology at universities. And I didn't want to stay in academia, at least not immediately after going to the school already for so long. I wanted to be out of school. So I didn't really consider this as a real career until I didn't want to do practice anymore. So I did practice, veterinary practice, large animal and mixed animals for like around 3 years. Then at some point I wanted to do a PhD and specialize. And I went through all the list of the European veterinary specialties that we have. And by means of elimination, there were just 2 left. So I eliminated like herd health, internal medicine, everything that I didn't want to do. And there were 2 things left, horses, and I didn't know if it's going to be like internal or whatever, something with horses, and pathology. And I figured out how to go do an externship in a place that could do a combined program. So it was like kind of strategic, because when I realized how long it's going to take me to do residency and a PhD, if I wanted to do both, I'm like, I'm not doing separate because then I'm going to be too old. So I did a joint. I find a place where I could do a joint one. And I was supposed to be 6 weeks in the horse clinic and 6 weeks in pathology to just check and like make them love me and maybe accept me for the residency later. And I started in pathology. After I think like 2 weeks, I called the horse clinic and I said, you know what? I'm not going to be doing this. I'm going to stay the full 3 months in pathology. And this was where I learned that you can do a lot more than just stay at the university and do diagnostics. And I was kind of inclined towards industry from the get-go, even though I had no idea what it meant. But that's how I started.
What did you learn along that journey that really helped springboard you into industry? I guess what advice would you give to someone who might want to go that direction?
Yeah, so my motivation for industry, so I was already 3 years in practice, in a private practice. So I kind of thought, hey, is there anything that I could do? Well, I learned that you could do industry. And I thought, for me personally, it was like more impact for your effort. It wasn't like one-on-one patient work. It wasn't case-based, patient-based. It was more like drug-based, and those drugs go to everyone if they're successful, and most of them doesn't go anywhere. But that's what we do. That's our job, right? And the advice, I didn't really have any training in that. I just knew I wanted to do that, and these were the jobs that I was applying once I was ready to apply for the job. So basically, the only advice at that point, especially if you like, and there are very few training programs. I think Charles River does some in Matawan, where you can actually like really take part in the industry side of things. I think some pharma companies do that. I didn't take a part in any of that, but I was very clear that this is what I wanted to do. So then, whoever would take me with the qualifications that I had at the time, which weren't too high, because when you begin, you just begin, right? You start learning.
And now you have website, the Digital Pathology Place, and an online presence, as well as I think every Friday you do like live streams about digital pathology, and you attend all these different digital pathology conferences like Path Visions. Can you tell us how then you went from pathology to pathology in the digital realm?
Totally. So let me tell you, in general, my digital pathology story. Digital pathology was like something not to touch, and I was super intimidated with it at the beginning, because when I was doing my residency, we had one scanner, but this scanner was just for conferences when you would do like slide presentations for people outside, and normally we would just do the multi-headed scope, and there was like one dedicated person who could touch it, so it wasn't something that was accessible. It was like a high-tech thing that I wouldn't touch. So at the beginning, I thought like it's for the elites, it's for the chosen ones. And then things shifted where after already finishing like my main PhD project, I had to do a side project, which was some kind of IHC quantification. I don't even remember the marker. It was in the skin where I had to stain fibroblasts with some aging marker. I don't know, I don't even remember. It doesn't matter. But I was looking at these images and they were like a little bit positive, a little bit negative. And I'm like, there is no way I will be consistent doing this on a glass slide. Like zero chance. I don't trust myself as much as I will look at these images. No way. Let me take a picture of that. And a digital camera was accessible, right? And we may think, okay, like taking a picture of a slide is not digital pathology, but the moment you make a pathology image digital, it enters the space of digital pathology. So that was my first step, which I don't even think it's going to be digital pathology. It's going to lead me anywhere. But I had to take these pictures, and it was super simple quantification. I would like figure out some kind of threshold, had a picture on one side, had a picture on the other side, and manually mark the dots and then count them. Because then I was able to be more consistent with my evaluation. And then there was another breakthrough in digital pathology. So when I was preparing for the boards for the second time, because I failed boards the first time, and I failed it because of histology. It was still the old style when people would go still to Ames. So you will know exactly when I took my boards, because I was the last time in Ames, and I failed. I don't know if I even passed anything, but I very much failed histology. And I developed this dislike for the microscope that was combined with then, I was finishing my PhD, I was finishing the residency, and I was like moving with a microscope was difficult. I don't know if I even had a microscope at that time. So I ended up with some like $500 microscope from Amazon, and I hated it. I had all the slides, and I was like procrastinating looking at these slides so much for my second round of preparation. I was already freaked out. And then I was like, okay, that is not going to help me pass the boards. Let me figure something out. And I thought, okay, what am I trying to achieve here? I'm trying to evaluate the content of the slide. And there was this, I think you guys do everything digitally now, right? As a multiple.
Yep, it's all on a computer.
Yeah, so what people were doing there then, they would bring their own microscope to the exam. It's a super stressful situation, right? You want to be comfortable with your equipment. You want to like mimic the environment that you studied in. But I was like, first of all, my microscope is worse than the ones they have there. And second, I'm not even looking at these slides because I started hating it so much. So what do? I need to figure out how to evaluate the content. So obviously by then, not by then, since a long time, the JPC slides were online. So we had a little study group of 4 people, and with one friend, we decided, okay, let's do our digital rounds. Like, I don't care if I don't know what's in this slide, a good microscope is not going to help me. It really is not going to matter if I bring my favorite microscope or whatever to the exam if I don't know what's in this slide. And I can learn what's in this slide on a digital version of everything is visible. So that's what we started doing, and I started liking histopathology again. Imagine, as a veterinary pathologist, right? So that kind of helped me pass the boards, helped me like digital. Well, I didn't have like any specific special feelings towards digital pathology, but that was a tool that helped me, a tool that I could use when I was traveling, a tool that I could use with somebody who was somewhere else. Very useful, helped me pass the board, right? And I didn't really have to do anything to figure out how to use it other than click a mouse and zoom in and zoom out with the mouse wheel. So no like special tech savviness needed there. And that's a very long answer to your question, but there is a third step. Third step is my first job. My first job was actually in the digital pathology space. I became a pathologist at a digital pathology company, image analysis company. And I was, my boss was a medical pathologist, so he had like more of a managerial role, and I was the only pathologist. So it's kind of a unique situation when you start, and it was kind of double-sided intro to where I am right now. Because on one side was digital pathology, on the other side was industry. Because this company, even though it was not a pharmaceutical company, they would provide image analysis for pharma, maybe for some CROs, but basically do image analysis. So I go there straight out of residency with not really too much real-life pathology experience, but enough tissue knowledge to become the pathology expert in that group, right? I had the highest level of pathology knowledge, which kind of puts you in an interesting position coming from somewhere where you are like totally the person who struggles and is learning everything to somewhere where they take you out of your environment, put you somewhere else, and you realize, hey, I actually know something that other people don't know. And there's plenty of people who know more than me in that area. But in this particular setting, I bring value with what I already know. And then there was my pathology expertise on top of what we were doing for digital pathology. So let me stop here for this question. That was my journey.
Excellent. And can you describe for us sort of what your everyday looks like now in your current role?
I love my current role and my everyday because I work remotely and read digital slides for Charles River Laboratories. I'm a toxicologic pathologist at the CRO, Contract Research Organization. And I have a dual role at the company, which is even more fantastic because I'm not in charge, but I'm kind of a strong contributor to the digital pathology initiative in the company. And I have been there since the very beginning. I have been that in one form or another. And then I'm just like a normal toxicologic pathologist evaluating slides that support pharmaceutical companies with their drug development pipelines. Often it's toxicological safety, some discovery work, which is like earlier in the drug development pipeline. Safety comes a little later when the companies are already like getting ready to put the substances, put the test items, as we call it, test articles, later into clinical trials into people. And the super cool things are I still contribute to digital pathology, which is where my kind of pathology journey started. And I work from home on digital slides. So that gives me a lot of flexibility in terms of when I can do my job. Part of my work is in a regulated environment. So it's not that I can just take my laptop and go and do stuff anywhere. It has to be in a specific validated setup for validated work. But I can also do it internationally. So I'm from Poland and I still have family in Poland and we go there sometimes for extended periods of time. And my work lets me do that.
What advice would you give for trainees out there who would like to get more experience with digital pathology?
Go to the JPC website and start looking at slides digitally. It's not a steep learning curve right now. Basically, working with digital images. Then different applications of digital pathology require a little bit of different, studying expertise. But everybody is digital native right now. It's not that we have a problem with navigating a slide. And also the software providers for digital pathology slide viewing, they are very conscientious about our workflow. So it's something simple. You open it, and you will be able to navigate the slide and you're going to be able to evaluate what's on the slide because you were trained for that. Even though if you trained on a microscope, the underlying technology of digital pathology is light microscopy. Every scanner has like a lens and light source and everything that the microscope has. It just translates the image on the glass slide into pixels to make it digital and visualizable. I don't know if that's a word. Visualizable on a screen.
And for our listeners out there, the JPC is the Joint Pathology Center. Fantastic resource, again, if you are studying or just want to get more comfortable. And then the Davis Thompson Foundation also has a platform now called Noah's Slidebox that is very comparable to that. So fantastic. And since you've been out in the realm of digital pathology, is there something that you think we're doing right now that we could be doing better?
In terms of training? Or in terms of
training and maybe quality assurance as well. Start with training.
It's going to be part of my talk as well. So in terms of training, something that I would introduce is principles